In this video, you are going to learn how to give basic life support. Basic life support is an essential skill that any medical graduate should have. But often the setting in which you need to give basic life support can be different. For example, you may have to give basic life support by the side of the road. It is equally important to ensure your own safety before you touch the child or attempt to give basic life support. For example, if the setting is due to an electrocution injury, then you touching the child without looking for dangers can result in an unexpected harm. Let's look at the objectives of this demonstration. Firstly, you will understand the structured approach to basic life support. Next, you will learn the sequence of basic life support. And then I will demonstrate the skills that are required to provide basic life support. In basic life support, it can be an infant or a newborn or a child. An infant is called any person aged from 1 month to 1 year, whereas a child is defined as any person aged from 1 year up to puberty. And remember, in basic life support, if you think it's a child, it's a child. It is important to follow the common approach of airway, breathing and circulation while delivering basic life support. However, if the child is a victim of trauma, then it's important to remember that the child's cervical spine should be protected before we attempt to secure the airway. And also, if it's likely that the child had bled, then it is important to consider catastrophic hemorrhage and control catastrophic hemorrhage before we attempt to protect the cervical spine and secure airway. However, in this training video, we consider airway and breathing and circulation approach. The first step in giving basic life support is to ensure your own safety. Look for signs of danger. For example, the child may be a victim of electrocution injury. So, an electric wire may be accidentally connected to the child. So, be mindful not to touch the child before you are sure that you are not exposed to any dangers. The next step is to assess the child's responsiveness. It can be difficult to assess the responsiveness in a collapsed child. You can look for evidence of breathing as well as check whether the child is responsive by rubbing the child's sternum. Baba, Baba. After you confirm that the child is not responsive, the next immediate step is to call for help. You may not be able to give basic life support alone, as you have to secure airway and then have to deliver breaths as well as give cardiac compressions. Therefore, it is very important that you immediately call for help. The next vital step is to apply airway opening maneuvers to open up the airway. And in doing so, while providing basic life support, we follow the approach of chin lift and jaw thrust. Head tilt is not recommended in basic life support as the child may be a victim of trauma. Chin lift is applied by placing palm of one hand on the forehead of the child and keeping 2 fingers underneath the tip of the mandible. And using the palm of the hand, apply backward pressure, and using the tip of the fingers, apply forward pressure on the tip of the mandible. Ideally, the upper jaw and the lower jaw should lie at the parallel level, and Make sure the child's mouth is kept open. Position the 4th and 5th digits of each hand underneath and behind the patient's mandible. And now, while maintaining the stabilization of patient's head and neck, push each side of the patient's mandible forwards or anteriorly until the lower jaw is extended. And it is important to place your hands on the bone, the mandibular bone, so that you will not apply any pressure on the soft tissue structures of the neck. While applying airway opening maneuvers, the next step is to look for any evidence of breathing. The technique that you follow to assess for evidence of breathing is called look, listen and feel. For that, you need to position straight in front of the nose of the child and then focus yourself for the chest rise. So in this technique, you will be able to feel breath sounds and hear for breath sounds as well as for evidence of chest rise, which will give you a very good overview of the evidence of breathing. Once you have confirmed that there is no evidence of breathing, the next step is to deliver 2 rescue breaths. So rescue breaths in basic life support scenarios can be delivered as mouth to mouth or mouth to nose rescue breaths, as you may not be able to find face masks and embo bags. And make sure that you keep a tissue in between the mouth of the child and your mouth and make a tight seal while giving mouth-to-mouth rescue breaths. Note the chest rise. If you have face masks available, it's very important to select a tightly fitting, correct size face mask. Note, this face mask is too small for this child because it's applying pressure over the nose. And if you look at this one, this is too large because it's going beyond the chin as well as it's pressing the eyeballs. And this face mask does not go beyond the chin as well as it does not press on the eyeballs, and also it contains both the nose and the mouth of the child. So this is a correct size face mask. If you have an ambo bag, connect the ambo bag to the correctly fitting face mask, and they should not be applied on the face of the child. Make sure that you apply a tight seal, and also you can hold the mask in a technique called E. So with a C, you try to hold the face mask, and then with the E or the other 3 fingers of your hand, you try to press on the mandible, making sure not to press on the soft tissue structures so that you can maintain the airway patency of the child. And then you can deliver 2 breaths. Once you have delivered 2 rescue breaths, the next step is to feel for the central pulse. The central pulse can be felt at the carotid artery or the brachial artery. To feel for the brachial pulse, keep 3 fingers over the brachial artery and then wait for up to 10 seconds to feel for the pulse. Or alternatively, you can place the thumb of your hand on the carotid artery and feel for up to 10 seconds for carotid pulse. It's important to remember that pulse is extremely difficult to be felt in a collapsed child. So also you may combine your findings with any evidence of breathing as well. In the absence of a central pulse, the next step is to immediately commence chest compressions. The chest compressions can be delivered in two methods, and they are called two-finger method and chest encircling method. And I will demonstrate how they can be delivered. It's important to remember that when you combine cardiac compressions with rescue breaths, keep a rate or a ratio of 15 chest compressions per 2 rescue breaths. And also make sure that you deliver chest compressions at 100 times per minute. In two-finger method, place your index finger and middle finger over the lower half of the sternum and press at least 1/3 of the diameter of the chest. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. In chest encircling method, place both hands encircling the chest and keep the two thumbs over the lower half of the sternum. And similar to the previous technique, press 1/3 of the diameter of the chest. 1, 2, and so on. Let's now see how we can deliver combined chest compressions and rescue breaths to a child with no signs of breathing and no central pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Squeeze 1, squeeze 2. Once you confirm that there is evidence of breathing and the central pulses are present, then you can place the child in the recovery position. Let's summarize what we learned. Basic life support is delivered to a child with no signs of life, which means there is no central pulse and there are no signs of breathing. In doing so, we follow the common approach of stabilizing airway, breathing and circulation. But it's extremely important that in a basic life support scenario, we also follow the DRS approach, which stands for looking for signs of danger, assessing responsiveness, and then calling for help before we start doing airway opening maneuvers. Once we have got help, then start opening up the airway using the chin lift and jaw thrust maneuver. And once the airway is secured, in that way you can deliver 2 rescue breaths, which can be delivered as mouth to mouth or mouth to nose and mouth rescue breaths. And then assess for evidence of breathing by the chest rise using the look, listen, feel technique. And once there is breathing, feel for the central pulse. Absent central pulse is an indication to immediately commence cardiac compressions. When we deliver cardiac compressions, we keep the ratio of cardiac compressions to rescue breaths as 15:2. And also make sure that you deliver the chest compressions at 100 per minute. And continue the cycle of cardiopulmonary resuscitation for 1 minute. And after 1 minute, reassess for signs of life, including for the presence of central pulse and for evidence of breathing. If there is no evidence of life, then you will have to redo or do the cardiopulmonary resuscitation again for another 1 minute and reassess. And at the time you find there are signs of life, then you can stop delivering cardiac compressions and rescue breaths and keep the child in the recovery position.